Hello everyone. A couple of people have been asking me, Dr. Amy, discuss Chalazion, and that's what I want to do today. So what is Chalazion? Chalazion is simply a swelling on our lid. So it could be the upper lid or it could be the lower lid. And what causes Chalazion is simply the blockage of a certain gland we call meibomian gland. So meibomian glands are all glands on our lid region. What they do is they produce oil that helps our tears to become stable. And so when these meibomian glands are not functioning very well, the oil doesn't get produced, our tears are unstable, and eventually we develop dry eyes. So you see that these glands are really important. So what happens when they get blocked is that this oil builds up and becomes a firm lump on our lid region that we call Chalazion. So what are the things that can cause Chalazion? If these glands are not working, meibomian gland dysfunction, if your lid area is not clean, poor lid hygiene, infection, like infection of the lid region, blepharitis. Also, if you are having a stye. So a stye, unlike Chalazion, is painful, is red, is caused by infection. So if you're having recurrent styes, it can actually lead to a Chalazion. So how do we manage Chalazion? We start up to advise patients to do a warm compress. So you put a clean warm cloth over the region for like 10 to 15 minutes daily, 3 to 4 times a day. A gentle massage can also work, but it is important to avoid squeezing because squeezing can actually cause scarring of that area. If this doesn't work, we can prescribe antibiotics, try certain injections, and if this doesn't work, then we go ahead and do a surgical removal, especially if it is recurrent, if it is affecting your vision, if it is large. So it is important. If you have any lid swelling, don't just assume it's nothing. It is important for you to have it checked because in fact, sometimes it might not be a Chalazion, it might not be a stye, it might be something else that we really need to quickly evaluate and manage. Let us check.